Greetings.
Yeah, greetings. So today we are going to be talking about the safest food to eat during pregnancy. I know a lot of you have been asking whether is this one safe in pregnancy? Is this food? Can I eat this food? Can I eat macaroni in pregnancy? Can I eat ugu in pregnancy? Some people ask whether they can drink alcohol and the rest. Some have been asking whether they can eat shawarma in pregnancy. So we are going to answer a lot of your questions today. So the topic of today's interactive session I'm having with Nurse Maggie is to talk about the food you should eat and the food you should not eat during pregnancy. The food to eat and the food to avoid during pregnancy. And I want to also say something. Pregnancy is not punishment. Because some of you eat well before. You used to eat well, you enjoy yourself. But immediately you got pregnant, you start hearing different things, and all of a sudden you stop eating well, and you now start losing weight. Some of you are now so haggard. It's not that you don't have the desire to eat, but because you are scared of what to eat. Somebody even said they told her not to eat unripe plantain. That unripe plantain causes jaundice. I didn't even know whether to start laughing in the comment section or the rest, but I just decided to say, this is not true. Imagine not eating unripe plantain. The food you should be eating, especially in pregnancy, they are telling you not to eat it. How will you not now get the iron to get for your blood? So that's it. So we must educate you on some of these things. So do you have any food in mind that you want to tell our followers here to eat and to avoid?
Okay. For that, ugu. Taking of ugu, you need ugu. Taking of vegetables, you need it for your blood to boost them.
Ugu is very rich in iron.
Very, very good.
Iron. And iron is needed to stimulate your bone marrow for red blood cell production. So some of you will say your PCV is low. Your PCV is low. You go and do PCV check. They will tell you your PCV is 20, PCV is 25, PCV is 28, and the rest. So most of your PCV are less than 10 because you are not eating well. So, listening.
Taking of protein, enough protein. You need enough protein.
Like proteins, like
meat.
What kind of meat?
Beef, cow meat.
Yes, goat meat.
Goat meat.
Yes.
Then
liver.
Yes. Liver is very, very, very good.
Liver, kidney, cattle kidney, cattle liver, assorted. Eat well, That way, you used to eat this thing before. You just got pregnant now. They told you somebody called you from the village and said you should not eat, and all of a sudden you are not eating again. Mm-hmm. You can even eat snail.
Yes, snail is very
eggs.
Good.
Eat eggs, eat snail, eat fish, eat meat. Goat meat, cow meat, bush meat, any meat, just be eating, Just eat meat. Whether you fry it or you cook it or you roast it, just eat your meat. That's it. And it's not just some of you, it's only Coke you have been drinking since you got pregnant. So that's it. So we are still waiting. What about fufu?
Fufu, yes, fufu is okay, but not too much like that.
Okay.
Yes,
what about eba? You can eat. It's not that it's okay. It's not that when she said not too much, it does not mean that you should not eat it or it has one arm. It will cost to you. Just eat. You can eat eba. Yes. You can eat amala, right? Wheat, yes, wheat. Semo. You can eat semo. Eat fufu. See. Which other swallow is out there? Oatmeal. Oat swallow. There's oat swallow, yes. Right? There's oat swallow. You can eat a plantain amala. You can eat the cassava amala. Whichever amala you want to eat. Then the soups.
Soup. Taking of black soup.
Nice.
Black soup is very good. No, it contains those vegetables and also it's very good. Then taking of
bitter leaf soup.
That's black soup.
No, bitter leaf soup is not black soup. Black soup is that black. Yes, that's black soup. You will see the soup is black. Bitter leaf soup is the one they cook with bitter leaf.
Yes, it's true. Why that black soup, it contains different leaves.
Yes.
It's very, very
They add scent leaf, they add all the leaves.
Yes.
Bitter leaf soup, when I went to the east, this year, when I went to the east, I ate a lot. In fact, I was eating, the bitter leaf soup is nice, I was eating bitter leaf soup almost every day. In fact, every day I must eat bitter leaf soup. With there is a lot of obstacle in the soup.
Yes, if you don't like, you put enough snail, different
Yes.
things. So
Put snail, put okporoko in your soup.
then for that shawarma, you can take it, but not always.
Yes.
Just to satisfy your craving. Not
Yes, thank you.
always.
You can take shawarma, but not that you will now make it your food morning, afternoon, because it does not contain all the nutrients you need.
Yes.
That's why they are saying not. She's saying not always. It does not contain all the nutrients you need. Shawarma does not contain all the vitamins or the iron or the nutrients you actually need. You must eat your real Nigerian food to get all the nutrients.
Leave Oyibo food for dinner.
Yes, leave Oyibo food. Eat your own food. In fact, even the Oyibos and even our people that are staying abroad, you will hear their doctor will tell them during antenatal to eat spinach.
Yes.
Because spinach is the closest vegetable to ugu. So eat spinach. Use spinach in your soup. Put it in your sauce. You can use it to cook beans. Anything you want to enjoy yourself. You can eat butter or put butter in your bread. There is another thing. They said pregnant women should not eat bread. I saw that one. Even somebody did a video on it that pregnant women should not eat bread. They were saying not. And I noticed something. Some people send me a lot of things to react to. See, the truth is, I don't react to anybody's video. I'm on my own on this social media. I don't react to any video. If you want to get real information, come to this page. You will get real information. But don't think I will react to it. You will see that. Check all my videos. I've never reacted to anybody's video. I don't react to people's video. That one, they will not put place side by side. The person will finish talking and now start talking. I know they do that one, no. I'm on my own. I don't want controversy. But eat bread.
Yes, eat bread.
Be eating bread. You can eat, what's it called? What kind of bread? Even though if you are in Lagos, you have access to agege bread. You know how sweet agege bread is? If you use it to eat a wagon. That Togo beans. You don't know Ewago, don't worry. When you get to Lagos, you know how Ewago is. Very, very, see, it's so nice. The smell of the oil is satisfying. The oil smell alone, when you perceive that smell, is satisfying. Then you can eat, you can take custard, eat carrots, mango, walnuts, oranges, all the fruits you know. There is pear now. All those pear they used to eat corn. You can eat it. Avocado pear. If you have access to it, you eat. You corn. It's corn season now. Eat corn. Then if you see mango, you eat. If you see cherry, agbalumo is even good because it helps to reduce this morning sickness and remove excessive salivation. Then the Hausa people, if you have access to tuwo, if it's tuwo that is hungry you, eat your tuwo. Tuwo is swallow. They use it's rice swallow. They use rice to make it.
Okay.
You can eat that one with your soup. The only thing you should not eat, the only food you should avoid, all this controversial food like pineapple. They say pineapple causes uterine contraction. In fact, researchers are divided on whether it is safe in pregnancy or it is not safe. So what I always advise people, any food that is controversial, avoid it.
Yes.
If they tell you it causes miscarriage, the other person tells you, they did research, it causes miscarriage. The other person tell you they did research, it does not cause miscarriage. See, avoid it. That's what you should do. Just leave it out. If you don't eat if you don't eat pineapple, nothing will happen to you. There are other fruits, right? You can eat suya, right? Eat suya is meat. If it's clean, you want to eat, you can eat. If you see elephant meat, I don't say you should go and start hunting our wildlife and now make our animals go extinct. But if you see elephant meat, eat. If you see lion meat, eat. So that's it. Just enjoy yourself, but don't take alcohol. Don't be taking cigarettes. Don't smoke cigarettes. Don't take alcohol. Some of you, you will now say, don't take agbo. Some of you will now say, doctor, can I take small stout? You cannot be taking small stout. Small stout is alcohol.
People feel like taking flutes. If you can just do juice.
Yeah.
Fruit juice and
Take fruit juice and what is somebody asked that whether she can take Star Radler because the alcohol content in Star Radler is 5%. It's still alcohol.
Alcohol is alcohol.
Alcohol is alcohol. Ogogoro is alcohol. You think alcohol is only ogogoro? It's still alcohol. It's beer. You cannot be taking Hero beer when you are pregnant. You cannot be taking Tiri, Goldberg, Small Star, Gouda. You cannot be taking them. They are all beer and they contain they are alcohol. They are alcohol. Those are alcoholic drinks.
Just pause. When you are giving birth, you can take whatever you want.
When you have no, not when you are breastfeeding.
No, after that.
You can return back to your life, but for the sake of your baby, for the sake of your baby, there are some things you cannot be doing. Some of you still want to. Somebody will say they are craving shisha. You cannot be craving shisha when you are pregnant. Leave shisha. See, let me tell you one thing. Immediately you take in, you are now responsible for a life. All those your young girl, sweet girl, WhatsApp girl life, you have to put a pause to it. Pregnancy does not mean your life has stopped, but it means that you are now carrying a baby. You are about to bring a child, a human being to life, and there are certain things you will do that will affect the life of that human being you are bringing to life.
Yes, you're taking full responsibility of that human being.
Yes, because the child is growing inside you. You don't want to give birth to a child that is not doing well in school just because of the thing you were smoking, you were taking alcohol during pregnancy. Some of you make this mistake. Before, you didn't even know you were pregnant, you were still living your lifestyle, but immediately you find out that you are pregnant, you have to stop. Even medications you take before, you have to you have to discuss with your doctor before you take any drug. Drink a lot of water. Drink a lot of water. You can eat butter, you can eat bama, right? Which other food is very common? Yam.
Yes.
Even ripe plantain. You can eat cocoyam, Irish potato, sweet potato, any one you can eat. But just avoid any food that will cause you trouble. Maybe you are thinking that in this video you are going to be told, don't eat this, don't eat it, don't eat it, don't eat it. No, nobody is telling you don't eat this. The only thing I always say,
eat what you want to eat, but be careful.
Be careful. Don't be taking alcohol.
Yes.
Don't be smoking. Don't take agbo. That's all. Don't eat pineapple. Don't be drinking zobo.
Yes, super.
Zobo is not good though. Zobo has been shown to cause miscarriage. So that's it. That's how you should avoid some certain things. All these pineapple, zobo, alcohol. Some of you will register in hospital. Then your mother-in-law will now register you in a native hospital.
Yeah,
you will not, they will not be missing things for you to take. Out of respect, you don't want to cause problem in the family. You now say you'll still be taking. No, you politely tell your mother-in-law that please, please, my doctor, use your doctor as an excuse. My doctor said I should not take agbo at all. That it's not safe for the baby. No, don't fight. Don't fight anybody. Say it in a very polite way that my doctor, use doctor as excuse. Not I will not take. There's nothing you can do. This is my house. No need to fight. Just say my doctor said that I should not take agbo. This is agbo. And my doctor said I should not register in native. That put pay to many things. Please, no need to be rushing, trying to eat your food though. I know what I'm talking about. Eat. Because some of you don't eat. And at the end of the day, you'll not be having children with low birth weight. Do you know the dangers associated with having a child with low birth weight? The dangers are many. After the child is born, the child will not be admitted. The child is prone to infection. You will not be in the hospital for months. Some of you will stay like 3 months. What are they trying to do? It's not that the baby is sick, but the baby does not have enough weight to survive in the environment. And when your baby have low birth weight, immunization becomes a problem. The child is prone to infection. So they will not be feeding the baby. Because you don't give the baby food for inside belly now. They will not start feeding the baby in the incubator until the baby gains certain weight before they discharge your baby. So avoid all this. So eat very well. Eat very well. Eat very well. Eat the way. See, some of you will say, if I eat too much, the baby will gain so much weight. See, how many women have you seen that ate too much that their baby Can you even eat too much in pregnancy? Most of you don't even have appetite to eat too much. You don't even have the appetite. So how are you eating too much? The small you eat, you say you are eating too much. So eat well.